Hello, and thank you for joining us for this edition of 12 Health. I'm Shannon Hegy, and today we are talking back to school and immunizations. And I'm joined by Dr. Carla Martin, a physician consultant with the Rhode Island Department of Health, as well as Dr. Beth Lange, a pediatrician with an office in East Providence, also with Brown Health. Thank you so much, both of you, for joining us today. Obviously, vaccines are a big topic right now. We've seen outbreaks across the country from people not getting those vaccines, children specifically. And as back to school comes around, I'm sure, we had trouble just getting this whole thing together because you both are so busy as we try to get every parent in there and get every child vaccinated. So let's talk first about the vaccines that every child needs going into kindergarten here in Rhode Island. Dr. Lange, I know you said you've got a lot of parents just scrambling to get in and get those right now, right?
Absolutely. The pediatric vaccination schedule is a well-researched schedule of vaccines given in a time setting that protects kids against getting serious illnesses. I think what we have lost over time is because vaccines are so successful, parents these days, sometimes even grandparents, have never seen a case of polio or never seen a case of meningitis. And so we forget how important these vaccines are. They're so important they've prevented us from seeing these illnesses. So we are currently protecting children against life-threatening illnesses such as whooping cough and meningitis and measles, mumps, rubella, chickenpox. And the schedule is set up in a way that the immune system can build a response to protect against these illnesses. And so we ask that families talk to their pediatrician or family physician about what vaccines their children are due for at each visit, and answer any questions that the families may have about those important vaccines.
And how many of those are done all at once versus, do you have time? If you haven't gotten these done, is there time to get your child in before the start of school at this point?
There is always time to get vaccines because they are so important. But the vaccines don't just happen at kindergarten or age 4. We start giving vaccines to babies as soon as they're born. They get a hepatitis B vaccine in the hospital. In the season, they get an RSV vaccine in the hospital. And so at every baby checkup, pediatricians and families are talking about the age-appropriate vaccines. So by the time a child has reached kindergarten entry age, they have more than likely already had the vaccinations that they need in order to safely attend school.
So, Dr. Martin, I know I have the list here of what every child entering kindergarten needs. That's Tdap, which is tetanus, diphtheria. I'm not going to get the other two if you want to fill in the blank for me.
Pertussis, yeah.
Yes, pertussis. Hepatitis B, as Dr. Lange mentioned, polio, chickenpox, and MMR, which is the measles, mumps, and rubella vaccine. I'd be remiss if I didn't mention the fact that we have an influx of measles cases in the country, which had been basically eradicated here in the U.S. We've got, since August 5th, 1,356 confirmed measles cases in 41 jurisdictions, including Rhode Island. I know in Rhode Island, I believe, Dr. Martin, and I'm sure you can answer this, that was a case of a child who had traveled outside of the country.
Yes, correct.
How difficult is it for you to see these cases expanding when they had been completely eradicated?
Well, as you know, people who as physicians who take care of children, and I think it's very frustrating. And it's not just children. There are many people at risk for measles. We're lucky in that in our state we maintain some of the highest vaccination rates in the country for measles and for other childhood diseases. And it's honestly, it's very frustrating. It's very scary. For those of us who believe in sort of evidence, I think it's especially frustrating. And, like Dr. Lange mentioned, these are diseases that we haven't seen for a long time, and they are not benign, and they can be life-threatening. And I think that's the key. That's what's, very frustrating.
A lot of these, based on the data I've seen, is that a lot of this vaccine hesitancy has happened post-COVID. A lot of the mistrust with vaccines, with the medical community, has happened post-COVID. What is it? What are the, misinformation? Of course, a lot of that spreads on social media, online. What is kind of driving that? What is maybe the main misconception or thing that's spreading that's making people hesitant to get that vaccine?
Well, there are some things that started pre-COVID. this false belief that there's a link with autism and particularly the MMR vaccine. That has been completely disproven. There have been numerous studies. And I think because of the rise in social media use, there are people who are not educated about vaccinations, who don't have the experience that your pediatrician might have. And they have a platform where they could just present their ideas and people listen. Millions of people will listen. And I think that's the tough thing. So I think it's really important that those of us in public health, those of us who are medical professionals, really, those of us who have trust with our patients, really talk to our patients about the importance of vaccinations. And, really, I think the only way to counter the misinformation is by having these conversations with our patients. Yeah, I think this misinformation, this distrust started before COVID, but it's been fueled after COVID, it seems, just by social media.
What do you do, I guess, from the Department of Health standpoint? I know if social media is where the misinformation spreading, what do you do to try to battle that? Do you go on social media and try to make sure there's lots of posts? And because I think that's the thing that's really hard is, as a doctor, you're saying this has been proven to not be true. But if you already don't trust doctors or the medical community as a parent, how do you get through to people? How is the Department of Health trying to get through to people to make sure that they understand that this is a safe vaccine?
I mean, part of our job is to do programs like this through various, through radio, through podcasts, through TV, talking to our patients and doing live sort of presentations with community members. I mean, it's, we're doing sort of our best to counter this and also to really encourage professional, physicians and all healthcare professionals to really talk to their patients. I mean, I think that's probably key, is having that one-on-one, encouraging people to have that conversation with their healthcare provider.
Dr. Lange, have you seen that? Have you had some parents come in and be like, I'm seeing this stuff online. I don't know what to believe anymore.
I very much appreciate when families bring to me their concerns and what they're seeing online or hearing from their friends, because then I can directly address what those concerns are and to support the scientific piece of the information and to dispel the stuff that is urban myth or that has been scientifically disproven. I think one of the things we're hearing these days is parents keep talking about parent choice. It's my choice whether I vaccinate a child or not. And it is always a parent's choice to make the best decisions for their children, just like they have them wear bike helmets, they have them wear car seats. We wouldn't even think about putting a child in a car without a car seat. The thing about the measles vaccine, the measles, mumps, and rubella, is we're not only vaccinating children to protect the children, we're also protecting the community. All vaccines are protecting people against diseases that are out there. Germs, bacteria, and viruses, their job is to make us sick. And so when all of us are protected, the bacteria and viruses can't do their job. Measles in particular requires that 95% of the community is protected and vaccinated against measles. So if enough parents decide to have their parent choice and choose not to vaccinate their child against measles, it challenges the rest of us in the community because measles comes in, and even people who are fully protected against measles with their 2 vaccines may be at risk. We're also protecting people who can't get the vaccine. We have many children in this state who are undergoing chemotherapy for cancer, who are taking medications that suppress their immune systems because of skin conditions, gastroenterology conditions. We have many parents who also are immunocompromised. They've had transplants. When we get vaccinated, we're protecting our community and we're protecting all those other people too. So it may be a parent's choice to have a conversation with their healthcare provider, but the choices that we make also impact other people. And I think that's the 2-pronged approach to why vaccines are important, to love our children and to love and take care of our community too.
That's the whole herd immunity, right?
That's the whole herd immunity, yes ma'am.
All right. So we went through kind of the ones you need before your child goes into kindergarten. As you mentioned, those start way before kindergarten. They start getting those as a baby. Once we get to 7th grade, we add in the HPV vaccine. And kind of clarify this for me, because if you go on to the Rhode Island Department of Health's website, it says it's required, but there's also a line in bold that says no child should be held out of school for not getting this vaccine. Can you clarify that for me, Dr. Martin?
Well, people could ask for an exemption, just like they can for other vaccinations. And that's the right of a family to choose an exemption. Um, and I think as someone who really applauds that we have a vaccine that prevents cancer,
Mm.
I find it, particularly frustrating when someone decides to not have their child vaccinated against HPV.
What is it about
But
that one? Because even when I posted,
yeah,
asking to see if any parents wanted to talk about this, and a ton of the comments, I mean, the comments devolved into, again, this back and forth of people saying, you
mhm.
don't need to get every vaccine, versus like, how could you not get every vaccine? It is very, very, heated topic. But when it came to the HPV one, that seemed to be the one that was really driving a lot of the comments. What is it about it that has caused kind of so much disagreement among parents?
I think, again, there's a lot of misinformation on social media about it. And then there's this perception by some parents that giving that vaccine, to someone going into seventh grade almost sort of opens the path for them to become sexually active. There's something, I think this might be community specific because I work mostly with a lot of Latino parents, and there's just this misconception that it's sort of encouraging a child to be sexually active, which is it's not true at all. I mean, this is to protect kids from getting HPV in the future. Um, so yeah, there's something about that, and again, there's a lot of misinformation on social media, TikTok, YouTube, about the HPV vaccine, and it's really an incredibly effective vaccine. And and we can give it until people are young adults. So if someone hasn't gotten the vaccine, on the recommended schedule, they could still get it later.
Right. I'm going to take a quick break. We're going to come back and talk about COVID vaccine recommendations as well as the RSV vaccine. Stay with us. Welcome back to this edition of 12 Health, where we are talking about back-to-school vaccinations. I'm joined by Dr. Carla Martin, a physician consultant with the Rhode Island Department of Health, as well as Dr. Beth Lange, a pediatrician with Brown Health with an office in East Providence. Again, thank you, both of you, for being with us today. So before we took the break, we were talking about all the vaccines you need that are required for students going into school. Now I want to talk about, obviously, the COVID vaccine recommendations have changed at the federal level. Now it is, the CDC is recommending everybody 18 and up get the vaccine, which is different from what it used to be. But Dr. Lange, you just told me that the American Academy of Pediatrics just came out with its own recommendations this morning that are different from what the CDC is recommending. So if you will, spell that out for us and how they differ.
Absolutely. The last, in this current administration, it has been difficult to continue to go with information that is scientifically based. And so the current CDC recommendations to not have children receive the COVID vaccine as a standard vaccine are not based on the scientific data that we have. This morning, the American Academy of Pediatrics, continuing in the scientific rigor, did produce a policy statement where they recommend, based on science, that all children 6 months of age to 23 months of age receive a COVID vaccine, and that children ages 2 through 17 receive a vaccine if they have a chronic health condition that puts them at higher risk for significant infection from COVID, or if their parents have the desire to have that. The reason why the American Academy of Pediatrics recommended that is if you look at statistically who was admitted to the hospital and specifically who was admitted to the ICU with a serious respiratory infection from COVID, it was our young children, specifically our children less than 6 months of age, and those babies can't get the vaccine themselves. Those babies rely on their pregnant mothers getting the vaccine during pregnancy. So that's a whole other category of misinformation right now that's in the current CDC recommendations that hopefully will be changed by our obstetrician colleagues to make sure that the COVID vaccine is available for pregnant persons as well. But I appreciate the American Academy of Pediatrics continuing to work with the science so we can make recommendations for vaccines that keep children all healthy. And I encourage people to look at scientific data when they're making the decisions for their own children about the COVID vaccination this season.
Yeah, Dr. Martin, it's obviously such a new world still with the COVID vaccine, with everything we're still learning about it. And it's really confusing for parents. They're getting information from all different levels and all different areas. How do you help them understand where to go from here?
Well, the Rhode Island Department of Health, as Dr. Lange mentioned also, is still recommending the COVID vaccine for children 6 months and up. And we will follow along with our colleagues at the American Academy of Pediatrics, the American College of Physicians, and the American Academy of Family Physicians. We believe that these organizations follow the evidence, and also for pregnant women, we still are recommending the vaccine for pregnant women to protect themselves. So women who are pregnant who develop COVID are at higher risk, and to protect their infants. We're still recommending the vaccine as the evidence supported it, and we always welcome people to call the Department of Health, our helpline, 222-5960, and also to use us as a resource. We have a social media presence. We have a website where we provide all up-to-date information. It's been quite challenging.
Yeah, are you concerned? I mean, we already know how tough flu season can be on schools once we're all inside and it's wintertime. Are you concerned that we're going to get a double whammy now that these new CDC recommendations came out and you're trying to, battle them with your own recommendations and the Academy of Pediatrics?
I mean, it's hard to predict. I mean, this is all hypothetical. But what we've seen over the past years is just, we've had really high rates of different respiratory infections. And it's concerning. You had mentioned earlier about exemptions for vaccines in general. And we have seen an increased number of Rhode Island students with religious exemptions for vaccines. So it's gone up for kids entering kindergarten from 2020 to 21, comparing to 2024 to 25, it went from 1 to 1.7% of exemptions for vaccinations. We saw the same thing for people entering 7th grade and people entering 12th grade, with some increases in children who were whose parents were requesting an exemption. So, I mean, the concern is, how this year will pan out, and hopefully we could really encourage parents to vaccinate their children against the flu and against COVID. But it's not without its challenges.
I also want to get into, we're talking about respiratory infections, RSV. And again, this is a newer, what was 2023, I believe we got this vaccine, recommended for pregnant women, but also babies. Can you explain what the recommendations are, Dr. Lange, for this vaccine?
Sure. So the recommendations for the vaccine that was used last year and will be used again this year is for babies up to 8 months of age in the season who will be eligible to receive an anti-RSV vaccine if their mother did not receive it during the pregnancy before the baby was delivered. Last year alone, the data shows a significant decrease in hospitalizations and ICU admissions because of this RSV vaccine. And so we're very excited to be able to administer this vaccine again this year.
That's a big breakthrough, right? It's
a big breakthrough. Our office is already receiving phone calls. People can't wait. We'll probably start giving the vaccines in October, I think, is according to the Department of Health schedule. RSV is a very significant illness. We saw spikes of it not only in our babies, but also in our grandparents. So people have been seeing ads about that as well on the TV to make sure that grandparents as well as the babies get protected. RSV is a significant infection, causes a lot of respiratory distress, and especially for babies who are born prematurely or who have other chronic health conditions, it can be a life-threatening infection.
Yeah, I feel like if you talk to most parents, they probably know someone whose child has been hospitalized with RSV. That's how common it is. And then it overruns the hospitals at a time when other children need to get in. Dr. Martin, is there any hesitancy on that one? Or do you find that more parents are excited to hear that their children aren't as at risk because of this?
I think in general, the RSV has been more sort of accepted. And just a reminder, adults over age 75, we recommend getting an RSV vaccine as well. And if you're an adult 50 to 74 and you have chronic disease, something that puts you more at risk if you get infected with RSV, we also recommend a vaccination as well.
Okay.
If I may build on my colleague's point, the fact that there's enthusiasm for the RSV vaccine, which has only been around for a year, I think specifically highlights our challenge with the other vaccines.
It doesn't seem to make any
Parents
sense.
today know exactly what RSV is. They know of a family that had a story of a significant infection. If we talk to people that grew up in the 50s, they had the exact same fear of polio and of measles and of meningitis. I am blessed to be a pediatrician for 33 years. The number of cases of meningitis that I saw during my training 33 years ago versus now, significantly different, and that's precisely because of vaccines. Most people don't know those days. Most people don't know to fear the illnesses that are in the kindergarten and 7th grade and 12th grade vaccine schedule, but they know RSV, and that's why they're enthusiastically adopting this vaccine. We need to continue to teach people that the diseases we don't see are equally fearful, and we don't want to have to go back to things that we know we can prevent now.
It's a great message as we wrap all this up. Dr. Martin, anything you want to say to parents out there?
I just, want to encourage people to vaccinate themselves and their children. Vaccines are safe. There've been numerous studies showing their safety, and they've really changed our lives. I mean, they saved millions and millions of people. And just really, if anyone has any questions, the Department of Health is always happy to answer questions if you call our helpline.
All right. Well, I want to thank you both for being with us. We're also going to put a nice list of resources for you to go and look up all the information on these vaccines on our website, because I know in the world of Google, sometimes you don't know what to trust and what link to go to. So we'll put those up for you on WPRI.com. Thank you both for joining me, and thank you for watching this edition of 12 Health.